You're with me, Julie Alli, on News and Views. Still to come, we'll be talking to Dr. Professor Bucks about the third wave, COVID wave, obviously in KZN, how they're going about testing and have realized that they are now into the third wave. Also on the show, we'll be talking with family physician in the Department of Family Medicine at Wits University. He is Professor Saabrie Musa about bullying and intimidation by the Jewish Report. But right now we're going to be talking to a Saabrie Chisty Burials Committee and just about how all burial committees are being absolutely overwhelmed by the number of mayats that we're seeing on a daily basis. And I just kind of wonder how these people cope. What is it that we need to do to support them? And how do we get past this? I mean, I'm absolutely reeling from the number of mayat announcements we receive on our women's group in the area I live in on a daily basis. So how do these people cope at the burial societies? Aboo is on the line. Let's hear. And also, more importantly, the situation's really very, very dire. But how can we support our brothers and sisters in this terrible pandemic? Aboo Syed, Assalamu alaikum. Welcome to the program.
Wa alaikum salam. Jazakallah for having me on.
You guys must be reeling, and reeling is a very mild word to even suggest what you guys are going through.
Gee, unfortunately, it is busy times again. So far, it looks even might be worse than the first wave, because the point is we don't know where on the peak are we.
Right.
And that's a scary thing. This weekend, we were inundated with number of mayats. I think on Saturday, we performed 14 janazas. Yesterday was close to 9. So this is really taking a toll on its volunteers,
right,
the male and female teams.
This is just Saabrie Chisty. This doesn't even take into account like CIT, etc.
No, it's only Saabrie Chisty, and yes, if we have to include CIT, FMYO, Jamiyat, so these are all the Johannesburg-based organizations. The numbers has really increased drastically, and everyone seems to be busy.
I did indicate at the start of the show that organizations like Saabrie Chisty, there are a few full-time paid members who work there, but the majority of the people there are volunteers. You guys must be stretched to the limit.
See, unfortunately, it was part of the plan initially when we started before the first wave, was to try and get more people trained. Previously, as known in the communities, there always used to be the elder Molana or an elder Appa that used to perform the ghusls. So because of guidelines and government regulations, those over 50 could not perform ghusls. So that's why we got younger teams involved, train them how to wear PPE, how to give ghusl, etc. So alhamdulillah, the teams have grown, but it is still taking its toll. And now with everyone back at work, everyone trying to shuffle around, giving a bit of time, it is becoming challenging.
And also the time, I mean, when a person passes on, it's not at a particular time to suit the burial societies. It's, 24/7. It could be 12 o'clock at night, 2 o'clock in the morning. And in most cases, it is a government regulation that you try and, very especially with the COVID janaza, that you bury ASAP. That must take its toll as well, because a lot of people are possibly family people. They have children, they have wives, etc.
Definitely, and this does make it a bit challenging at times, especially with the late night mayats or early mornings. So as much as we can, that's where we appeal to the family sometimes to let us suggest times. Because I know usually it always used to be that the family will say, okay, we'll have the mayat at 3 o'clock or after Asr, etc. In this case, it becomes a bit more difficult because, like you just mentioned, we needed to try and do it as soon as possible. And as much as we can, we need to try and comply with government regulations because we don't want them to take away this right of the Muslims.
Absolutely.
So it does take its toll onto the females and the males team because, like you well said, their mothers, their wives, they need to prepare meals at home, but quickly running away, giving ghusl, going back to their chores. It's also becoming mental strain on them because you're seeing every time different families going through the
Right.
grieving process, crying. So it does become emotionally stressful for all of us.
Now that you've just preempted my next question, and that is, I do hope and pray that you guys go through some sort of a debriefing or counseling session from time to time, because it definitely does have a mental impact on you as well. The type of work you're doing, it can't be easy dealing with mayits all the time, and then also trying to console these grieving families.
See, Alhamdulillah, that's why on our side, we're fortunate that we have medical practitioners as part of our teams. We also have psychologists as part of our teams. And yes, rightfully, as you said, the recommendation is after each case to try and have a bit of a debriefing before people runs off back to the normal chores. Just to talk about it, to talk about the process and to make it easier. Because that's the only way mentally people can be able to deal with it. Because like you said, it is emotionally stressful for everyone. People think it might be getting easier, you get numb to it.
No.
But I think as we just noticing, like the weekend, everyone that was there and said, no, it's becoming too much. People need to sincerely make dua that Allah Ta'ala can take away this pandemic from all of us.
Ameen. For people, young people, and this is really, we talk about as Muslims, we must pay it forward, we must be in service. This is truly a very noble service to be in, despite the fact that it is very mentally draining on the people who do this type of work. What sort of training do you take the people through, and how much time do they have to allow for training? If I decide to volunteer my services, how many days of training do I undergo, and when will I be ready to start doing the actual work?
So at this point in time, it's a bit difficult for us because we stopped training programs. We focus more on improving and enhancing the guys that are currently into the program. So the training usually used to be, it's a day for doing PPE, donning and doffing for everyone's safety. And then the ghusl program used to be different. Sometimes it used to take place over 3 nights. So they do it over applying kafan and then the ghusl procedure itself. So it becomes a practical and theory course. So all in all, it's about a 4-day course that we've been offering previously, but obviously we've been breaking it down and doing it over a period of time. So now what we're trying to do is, as more volunteers come in, we link them to the experience group. And that's how people can sort of get more involved and learn from each other.
Okay, so training on the job, so to speak.
Gee.
Are more young people willing to take on this type of work? Are you seeing more and more young people coming to offer their services voluntarily?
Alhamdulillah, in our teams, we do have, from the male and female teams, we have people from the age of about 25 to 45. And there is people coming forward. There's always people wanting to assist. For males, I suppose it's much more easier because there's much more things for them to do at the grave site. Like help us prepare for the viewing of the family, perhaps help us prepare down at the qabr. Guys can drive the hearses, etc. But for the females, it's more sort of specialized along the ghusl and maybe trying to assist the bereaving family and consoling them.
Right. Aboo, you at the forefront, you and all other burial societies are at the forefront of this pandemic, meaning that you see the number of people passing on and you're having to do burials on a very, very regular basis. Like you said, 12 some days, more or less other days. And that's a huge number. What is your message to our community? Because it seems to have really spiked in our community. I don't know if it's due to carelessness. Look, we know that our birth and our deaths are predestined by Almighty Allah subhanahu wa ta'ala, but the trauma and the suffering that a COVID patient goes through, you people are, you at the coal face of it all. What is your message to our community?
Definitely, and my message to everyone would be sort of, if I put my second cap on, which is from the ambulance department, like you said, we know birth and death is written by Allah, but we see how people suffer. We see how young people at home take the virus home, and the elders at home get more sick, suffer, and sometimes pass on. But we've also seen a lot of people suffering and recovering from it. But ultimately, the thing is, we should be doing what the government has been telling us for the last year now. But unfortunately, people are still in denial. People still don't wear masks. People still don't practice social distancing. So it's these little things that if people can do, it can stop the spread of the disease. It's more trying to stop the movement of people, which will stop the disease. But ultimately, you still find people not wearing a mask, moving about, and people have become more complacent. And I think that's why currently we're into the third wave.
Absolutely.
So we're hoping, honestly, most front care workers, because of the ambulance, we know that there's no hospital beds available. Saabrie Chisty ambulance has been driving around with patients looking for beds, going from one facility to the other facility.
Sure.
Some of the hospitals in Johannesburg, there's about a 2-day waiting period for people that are in casualty to get a bed.
Sure.
So I say this because we've experienced in the past weekend how we couldn't get patients, even though people have medical aids, they have the best of medical aids, there's no hospital beds available. People had to travel from Lenasia all the way to Pretoria to be admitted in the hospital. So it's really serious out there. And that's why our appeal to the community is, please take the necessary precautions, be safe, practice social distancing, wear a mask. And now it's time to sort of have our guards lifted up even more than before.
Absolutely.
Inshallah, the storm will pass. Inshallah, within a few weeks, we will be over this. But necessary precautions need to be taken.
Okay, we mustn't say a few weeks, because in a few weeks' time it's Bakri Eid, and then let's just hope and pray people don't start with their mass family gatherings and the Qurbani and all of that, that they are responsible, that they try and social distance, because it seems that is when and how we as a Muslim community has found ourselves in this situation because of the Eid gatherings that we've had this past Eid. So let's hope and pray, inshallah, common sense prevails. When we get over this, we can then all reconnect with our families and our loved ones. But Aboo and teams, all the teams right across all the burial societies, Aboo Syed, all I can say is our du'as with you. Keep up the sterling work. May Allah subhanahu wa ta'ala guide and protect all of you, because we need you guys. We need you guys in the community. So may Allah accept your du'as, your efforts, and guide and protect you all. Shukran so much for talking to us on the show this morning, and assalamu alaikum to you.
Ameen to the dua. Wa alaikum salam.
That was Aboo Syed from Saabrie Chisty talking about the dire situation that the burial societies are finding themselves in. And please, 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 good people, let common sense prevail. Let's do the necessary. Let's do the right thing. Let's be more Muslim by sanitizing, masking up, and social distancing. It's exactly 9:36.
Discover